Hi there, Eric Bakker, naturopath from New Zealand, author of Candida Crusher, formulator of the Candida range of products. Thanks for checking out my video. We're back again. We're going to now have a look at men. How to recognize the man with the yeast infection. So men are different from women, as we all know. So how do you know that a guy's got a yeast infection? Let me read something out of my book and then we'll explain a bit. In my clinical practice, about 75% of patients presenting with yeast infection-related problems are females. Yet guys develop yeast-related problems as well. In fact, I suspect there are a lot of men out there with a yeast infection, yet do very little to get well about it. They may even pass the problem on to their female companions, and then they may get it passed back to them. Women tend to be more keen to get their health on board than guys. I saw my father trying to conquer his yeast problems for many years. And it was only after many years that he went from doctor to doctor, who prescribed him antibiotic after drug after drug, finding nothing wrong with him. And this was in spite of several trips to the gastroenterologist, where he was examined by the way of an endoscope and had a barium enema performed, in addition to having every other test thrown at him. The diagnosis was there was no abnormal disease, and Dad was prescribed yet more antibiotics. That was in 1982. And unfortunately, almost 30 years on, nothing has changed. Yeast-infected patients are still diagnosed by the mainstream doctor as having no abnormal disease if they present to their medical doctor with several yeast-related signs and symptoms. So if you've been to many different people and they can't find what's wrong with you, if you suffer from bloating, from gas, abdominal discomfort, constipation, diarrhea, if you've been on antibiotics, if you can relate to this, do a stool test. Or go and see someone like me or anyone else who knows about Candida to get checked out because you may have this problem. So how do we recognize a male patient with a Candida yeast infection? I carefully check the toenails and see if there is any athlete's foot. There could be a fungal nail, or there could be infection between the toes. I find that men, for some reason unknown, more commonly complain of athlete's foot than women do. I'll often check the hands and scalp carefully too, particularly if they're manual workers. Guys tend to be less interested in general in hand and foot care than female patients, of course. So shoes and socks off, and we'll often find something if we have a good look. Guys who adjust their groin regularly, so men who sort of move their things around a bit, if you know what I mean. Just go to a bar and look around, especially where alcohol is served. Many men subconsciously touch their groin area, and I'll bet that they're either oblivious to the fact that they have a yeast infection or are too embarrassed to seek treatment. Many of the typical male patients I see are blue-collar workers, so these can be guys who drive trucks or work, as building people, they do physical manual work. They're working class men. They typically enjoy a beer or wine after work, a social drink at the weekend, and they snack on sweet stuff. They may have not the best diet, and when carefully questioned you'll find they burp, bloat and fart, which is quite typical for a guy who drinks beer and has a yeast infection. White collar office workers, so these are guys maybe earn a bit more money. These guys also work under high stress especially. They work long hours at the office. Many of them often drink alcohol and they eat over computers. They might eat takeaway food or eat out commonly with their colleagues. Some spend time with clients and conduct business over lunch and dinner or at conventions. Go to business meetings, and typically alcohol is served. They'll go out, they'll spend nights out, drinking again and partying. It's all quite common. Men with yeast infections are typically the ones who consume lots of beer, bread and sweet foods. Guys who crave alcohol in general are prime candidates for Candida. And if they don't crave alcohol, they'll crave sweet things like candies, chocolates, licorice. There could be cookies or cakes or sweet foods or soda drinks. These are all commonly consumed. Men whose wives suffer from vaginal thrush or yeast infection, the problem gets passed from the female to the male and then back to the male again. Men who are typically troubled by recurring digestive problems like abdominal pains, diarrhea, constipation, bloating, heartburn, flatulence. Men who've taken recurring courses of antibiotics for prostatitis, for acne, for sinusitis, for chest infections, any kind of infection, the doctor may have given them antibiotics and then may have given them another round and another round. Psoriasis. Check to see if a man has any of the typical or not so typical signs of Candida if he has psoriasis. If a man comes to my clinic with psoriasis, the first thing I check are digestive problems, and I check for yeast infection. When I wrote my book on psoriasis, I found that 3/4 of people with psoriasis in fact have Candida yeast infection. There's in fact now strong research linking both these conditions. Prostatitis. I've seen time and time again that the male's prostate problems often disappear entirely once his yeast infection is cleared up. Guys with prostatitis or urinary issues respond very well to Candida treatment, so these need to be aggressively treated. These cases are especially hard to solve. If they're beer drinkers or bourbon drinkers or whiskey drinkers or whatever, they have to stop. You can't clear prostatitis up in a male if he drinks alcohol all the time. And of course, poor motivation, depression or anxiety, ongoing stress-related issues, these are things you need to look out for. So if a guy does get depressed or anxious long-term and he's got problems, he needs to be checked out for this condition. So I hope that gives you a bit of an insight into men and yeast infections. Don't forget to subscribe. Don't forget also, please, to do my yeast infection quiz if you're a guy watching this or a female who suspects her male partner may have yeast infection. Go to yeastinfection.org and do my quiz. And also, check out candida.com for some good natural solutions on yeast infection. Thanks for checking out my video.